this is Mike Dilk with the Relax Back UK show on UK Health Radio, your global real feel-good radio station. On the Relax Back UK show, we explore all kinds of health topics, so keep listening and enjoy the ride. Hi, and thank you for joining me, Mike Dilk, on this week's Relax Back UK show. This week I look at a couple of topics that COVID has affected, and potentially affected them a great deal. The first is mental health, and in particular how employers can help staff.
I mean, one of the biggest barriers that people experience is just mustering, the courage to seek help for these conditions. So what we do is when you screen positive for one of these, one of our therapists reaches out to you and makes that conversation, that initial conversation, that ice-breaking moment that is quite difficult, much easier for you.
Dr. Andres Fonseca, CEO of Thrive, explains how taking this stuff digital can be very effective. Then many people are back shopping, but are all our shopping habits the same? Should our shopping habits be the same? Should we think about changing them?
So effectively, when you're in a retail premises or a shop and you're taken away from the busy shop floor in order to have a more personal consultation, generally in close proximity with the worker providing that service, and often in quite a small space. So for example, within pharmacy, having your eyes checked by an optician, hair and beauty therapy treatments and things along those lines. So that was the scope of our study, really, to look at people's use of face coverings and the factors that affect that behaviour in that quite specific retail context.
Becca Cannon is the principal scientist of human factors at the Institute of Occupational Medicine, and she describes the research they've done on this. So please do join us for a great show. Thank you.
This show is cool.
UK Health Radio, the station that makes you feel good.
It used to be hard to find the world's most wonderful alcohol-free drinks. Not anymore. Whether it's a health thing, a lifestyle thing, or you're trying new things, make sure you save yourself from the guessing game of the supermarket shelves and shop with zerozilchzip.co.uk for the world's most carefully curated range of alcohol-free beers, wines, spirits, and more. Health Radio listeners can save 5% with the code HEALTH5. Visit zerozilchzip.co.uk or click our banner on the UK Health Radio website. Discover alcohol freedom with Zero Zilch Zip, because nothing's better.
UK Health Radio, the station that makes you feel good.
So my first guest is Dr. Andres Fonseca. He's CEO of Thrive, the mental health app. And my first question to him really was, what is Thrive and what do you do?
Yeah, so we're a digital mental health service. We basically have an app that employees can access on their phones, and that does two main things. So it screens for the presence of common mental health conditions such as anxiety and depression. And if the person that is using it happens to screen positive for one of these, or it doesn't necessarily need to be one of those. It could be just stress or symptoms of burnout. Then it sort of produces a series of recommendations for them to follow and to sort of recover from these conditions. We also have a therapy service which is integrated with the platform. So one of the biggest barriers that people experience is just mustering, the courage to seek help for these conditions. So what we do is when you screen positive for one of these, one of our therapists reaches out to you and makes that conversation, that initial conversation, that ice-breaking moment that is quite difficult, much easier for you. So they reach out to you and they engage you.
So it's mental health gone digital.
Yes,
Very good.
Exactly, yes.
So let's move on. COVID and lockdown and all that sort of thing.
Yeah.
It really changed. Well, it changed our lives. It made a lot of people ill. Let's face it, lots of people died.
Yes.
But it changed a lot of our work habits. So did the nation's mental health change during lockdown as a result of these changes?
It did quite a lot. I mean, I think it resulted in greater isolation in general. A lot of people struggled. There were particular industries that were hit much harder than others. There was a lot of people that had a lot of financial instability, and it was quite hard to predict the future. All of those things increase your risk of having a mental health condition. And also, for example, if you look at key workers, we saw a great difference a great increase in the level of people that were screening positive for burnout. So if you look at key workers versus non-key workers, I mean, again, non-key workers was quite high. It was about 38%, what we saw during 2020 and 2021. But in key workers, it was 50% of key workers were having noticeable signs of burnout.
Okay, so this is a lot more serious than just people having more time on their hands to think, hang on a moment, I'm not sure I'm as happy with my life as I could be. Do you know what I mean? Or is that a bit of a facetious comment?
No, I mean, it's a lot more serious than that. And I mean, one of the problems, the perennial problems that we tend to have is that people think about this, think that maybe we're talking more about it, and a lot of people are sort of jumping on the bandwagon. But in reality, if you look at the figures, the problem is much greater than it was. There's also more awareness, so people are seeking help, which is a good thing. But again, still, the large majority of people that experience significant mental health problems are not able to come forward and seek help. And they find it difficult for different reasons. So one of the things is that they might feel that they could be dismissed, that people might think, oh, it's all in their heads, so therefore it's not real, so therefore why am I seeking help? So there's a barrier there immediately. There's a little bit of stigma. If I admit to others that I'm really, really struggling, what are they going to think of me? Is that going to affect my work, for example? So there's another barrier there. And there's a big barrier that comes from the symptoms of the conditions themselves. So if you're very anxious, you're going to be very worried about what people think, and that taking that first step might be really, really difficult because you're really not confident, and you might expect horrendous consequences for yourself when you're in that.
And I guess this creates a bit of a vicious circle, doesn't it?
It does, yeah. And the other one is if you're quite low in your mood, you're going to sort of have very low self-esteem and actually think that what you are going through is not worth talking to others about. They won't care, or that you should put up with it and that you shouldn't trouble others. Yeah.
So Andres, as things have, I was going to say get back to normal, but there's this phrase, the new normal, whatever that is, as things have changed, let's say, yes. And COVID is still with us, but with us in a different form, I guess. Has our mental health have we got out of the hole? Are people generally recovering and feeling better, or is this kind of still with us? Has this COVID got a bit of a sting in the tail?
I think people are thankful that things are opening up, and we see that again, one of the biggest things, and Mental Health Awareness Week, the theme this year was loneliness, or is loneliness, and actually that isolation that we had to go through had a massive impact on this factor, and we know that it's a massive risk factor for the development of mental health conditions. So thankfully that is easing, and people are able to sort of see one another and get support from one another, because just having that social network around us is very, very protective. So those are good, positive things that are happened, because we've come out of the lockdown and we're able to sort of see one another. However, I think some of the psychological impact still lingers, and some of the financial, economic impact, in people's own finances, not the economy at large, but people's own finances, still remains. And I think if you walk down the high street, a little bit beyond what is the high street, you'll see a lot of businesses are still closed, because hospitality and kind of like restaurants and those kinds of businesses have been hit massively, and so I think those effects are still lingering. I believe, yes.
Are there any effects that businesses that employ people, say, an office-based business? So some people are in the office, some people are working at home, or there's this hybrid mixture. Because there's this phrase which has been around for a while, presenteeism. Has that sort of come to the fore with all this, as it were?
Yes, actually, I mean, we know that presenteeism, as it were, has increased at the expense of what normally would be absenteeism before. When you had to turn up at the office, sometimes you actually couldn't. So in mental health, because you can probably get yourself to work, you're probably not able to function well at work, and you're probably overwhelmed, and the symptoms are so intense that you're having difficulty concentrating, and you're observed by this pessimism, not really having any faith in what you're doing, what you're capable of. So it is quite a difficult situation, but you can probably get yourself physically to work. Again, before the pandemic, because we all had to be in an office, perhaps you would take, if you were really feeling very, very unwell and very distressed, you would take the day off. When you're working from home, you might not take the day off, and you might sort of say that you are at work, but you're actually not able to really work. So again, you would be counted in this presenteeism figure. I mean, the thing to understand is, even before the pandemic, the costs associated with presenteeism were much greater than the costs associated with absenteeism for employers, right? And during the pandemic, that's actually grown. So the cost of presenteeism is even greater than it was.
Do you have any figures?
Yeah, it's about 50.
How many people might be suffering from this presenteeism, and what it's costing us all?
Yeah, so is the total cost of ill mental health to UK businesses is around £53 billion per year in the UK, which is a staggering number.
53 billion.
53 billion is what is calculated, and it's made up of three things. One is people leaving work because of their mental health. They're just not able to. It's completely sort of removing themselves from the workforce. So that's one chunk. And costs having to replace them and having to attract the right candidate and seeking employees that are missing, particularly key workers, as you might expect. Absenteeism in itself, which is probably the smallest chunk of the three, and then presenteeism, which is the biggest chunk of the three, is again people are able to get themselves to work, but are not able to perform. And it would be about something like 50% of the total cost will be the presenteeism in the presenteeism box.
So that's a lot of people and a lot of money.
Yes, exactly. So it's a staggering amount, really. 16% of the World Health Organization estimates that about 16% of all days lost are lost to mental health. But if you actually look at a study done in the UK specifically by Deloitte last year, that number is actually closer to 28% of all days lost to due to ill mental health. Yes,
I mean this must absolutely terrify large companies. Large companies that employ a lot of people. The biggest part of the company is made up with the people they employ. Without the people, they're nothing. They're just a bunch of tables and a few chairs. They have zero value whatsoever. So this must terrify a lot of companies. And in fact, this is a slightly different thread, but you can tell me if this kind of thought is rubbish or not. I have this idea that during COVID, quite a lot of people kind of took stock of their life and thought, hang on a moment, I'm not necessarily, I don't have mental health problems, but I'm not as happy as I could be. I don't want to work this hard. I don't want to sell my soul to the company. I want to have a better life. And I've got this feeling that this is terrifying companies, because, their best staff might turn around and say, look, sorry, I don't want to work 5 days a week. I'll see you 3. How's that? And I've got a feeling that this is terrifying big companies. Have you come across this?
I mean, that may happen in some cases, and actually, yes, it could be terrifying for companies, of course. But if they are making that positive change to safeguard their mental health, well, that's very welcome. And actually, those 3 days that they're able to do, those will probably be more productive for those companies if they are really prioritizing their mental well-being, right? In reality, what we tend to see is kind of the opposite. It's kind of people trying to stay at work, trying to sort of cope and really struggling and not being able to. And it's about trying to support them the best you can, and actually facilitating when they're trying to seek help. So the cost is interesting. If you calculate to a company the cost per employee in terms of mental ill health, not per employee that is off sick, but per employee. So if you have 100 employees, you can make the calculation. In the UK, it's between about £3,000 per employee to about £1,200 per employee at the low end. So £1,200 is still an enormous amount per year per employee that will cost you. And that's not those people wanting to have a part-time job, which is again great, and it could be that makes them more productive. No, it's about people not being able to sort of function and really struggling.
Right. So I mean, you kind of specialize in helping companies help people, don't, or help their staff so
exactly.
They do remain productive, because I mean there's something in it for the boss, the employer. He wants his staff to be happy so they can be productive. So you help all this happen.
Absolutely.
So and you've got a particular drive at the moment to try and address this. So tell us about that.
Yeah, no. So yes, that's actually what we do. Yes, we try and support companies to make it very easy for their employees to seek help. And as I was saying before, for different reasons, people are still finding it very hard. It's about 60% of people will not seek help, or and a lot of people that when they seek help is very delayed by a year or more, by which time the problem might be more serious. So by making it easy, by putting it on people's hands in an app, so they don't have to sort of tell their boss necessarily, they don't have to seek an appointment with a GP and lose time off work, they don't have to do any of those things, just eliminating those barriers to seek help. So we've got this campaign called I Get Help. So it's actually to sort of promote the fact that when you do need help, you should seek it. It's actually in your best interest, but also in the best interest of your family, people around you, to try and act on it as soon as possible. That you should take it seriously, that it is a health problem, and that the quicker you act, the better for you and for those around you. So yes, I mean, the campaign is I Get Help, we have it up on our website. So, I mean, normally it's thrive.uk.com, but, today you can visit igethelp.co.uk and you'll get some information about that as well.
So is the idea that companies just sort of make this available so staff can then sort of make use of it if they wish? I mean,
exactly.
Do you ever provide help for, if a boss is worried about a member of staff or a member of his team? This is potentially quite a difficult, embarrassing discussion to have, but do you ever kind of give advice on how to first address the issue or the situation? I mean, I wouldn't know where to start. I would start by saying, hey, let's go for a beer, which might be completely wrong. I don't know. Over to you. What should the boss do if he's worried?
Actually, changing the environment to have that conversation might be a very good way to get somebody to open up. And the important thing is that you've noticed something and that you are concerned and you're trying to facilitate and approach each other like human beings and approach each other out of concern. So that first step that you mentioned, that's not a bad thing to do. If you think that that's going to open the dialogue up, it's a perfectly reasonable thing to do. Let's go outside of work where it's perhaps more private, or the people don't necessarily are privy to our conversation, and we can have a chat about things. No, of course we do. So we do two main things. We provide training for managers, also for staff, but training for managers to be able to have those conversations and some of those tips that you might need when actually approaching a member of staff that you're a little bit worried about. And we also make our own therapists available to managers, so they can talk to one of our therapists and say, I am worried about a member of staff. I don't really know how to approach it. I've noticed these things. What should I do next? So we do that for them to give them that little bit of confidence, because people are worried about saying the wrong thing, as you're saying. And actually, that isn't such a problem. If you approach the other individual from a place of genuine concern, you're going to do well. So yeah, our therapists are there to support you in that endeavor.
Okay, so I mean, this sounds like very useful to companies that are trying to look after their best asset, which is their staff. Let's face it, without the staff,
absolutely,
there is no company most of the time. If people
absolutely,
are listening,
yes,
if people are listening to this, be it company owners, bosses, or actually members of staff who are thinking, actually, I need some help, but I don't want to talk to my boss, where can they get a bit more info, some help, some pointers?
Yeah, as I said, the best thing is perhaps to visit our website and perhaps talk to one of the members of our team who can give you a demo. So the website is thrive.uk.com, and as part of this campaign, we also have I Get Help. health.co.uk. So if you visit that page, and if you're an employer and you're interested in having a conversation about how you can support your workforce, how can you get that absenteeism lower, how can you get that presenteeism lower, and most importantly, look after your most important asset, as you were saying, Mike. How can you do that? Just come and give us a visit, and we'll be delighted to support you.
And the I Get campaign, that's an ongoing thing. That's not just this week only. That will be continuing.
That's continuing, yeah. So we just want to sort of get people more open, to open up about these issues and eliminate that difficulty that people have, that initial barrier that I mentioned at the beginning, where they're struggling to actually seek help, just to make that as positive as possible. But also, if you see other people around it that are getting help, maybe that gives you more confidence to get help yourself. That's what we want, and that's why we call it I Get Help.
Okay. Well, look, good luck with that. It sounds potentially very useful and could help an awful lot of people and an awful lot of bosses and owners as well. Let's not forget them.
Absolutely.
So, Andres, thank you very much indeed for chatting.
Thank you very much, Mike. Thank you for having me.
This show is cool.
UK Health Radio, the station that makes you feel good.
It used to be hard to find the world's most wonderful alcohol-free drinks. Not anymore. Whether it's a health thing, a lifestyle thing, or you're trying new things, make sure you save yourself from the guessing game of the supermarket shelves and shop with zerozilchzip.co.uk for the world's most carefully curated range of alcohol-free beers, wines, spirits, and more. Health Radio listeners can save 5% with the code HEALTH5. Visit zerozilchzip.co.uk or click our banner on the UK Health Radio website. Discover alcohol freedom with Zero Zilch Zip, because nothing's better.
UK Health Radio, the station that makes you feel good.
I really would like to say just a big thank you to all listeners. I really do appreciate all of you very much. Now, if in turn you've appreciated one of the guests or more than one of the guests on the Relax Back UK show, there's a chance to vote for them on the UK Health Radio Awards. Go to the UK Health Radio homepage, that's ukhealthradio.com. Click on the awards button and that will load up the voting pages. There are lots of categories there. You can scroll through them and vote for your favourite. One of the categories is presenter, so you can vote for me if you so wish. Go on, please do. All right, now my next guest is Rebecca Cannon. She's Principal Scientist of Human Factors at IOM, that's the Institute of Occupational Medicine. And I asked her if her role is essentially one of a psychologist.
I am indeed. I'm a health psychologist in qualification.
Okay, so that means you think about why people do what they do and how that might affect their health. Is have I got that right? More or less?
Absolutely. In a nutshell, that's fantastic. I think you're the first person that guessed that right. Yes.
Okay. Well, I should be very proud of myself then. I'll take that as a tick from you. So thank you. Now, the Institute of Occupational Medicine have been doing some research which is very relevant to all our lives, really, as we sort of come out of COVID, and it's looking at some of our shopping habits and what we get up to when we're shopping. But this isn't just shopping like in all sorts of shops. It's quite a specific range of shops. So, Rebecca, can you kind of tell us a little bit about what you did and the areas you kind of researched?
Yes, yeah, absolutely. So, the Institute of Occupational Medicine was awarded some funding as part of the Protect National Core Study, so funded by HSE, in order to look at transmission risk within different sectors. And in particular, the project that we were funded for was to have a look at the use of face coverings within retail consulting environments. So effectively, when you're in a retail premises or a shop, and you're taken away from the busy shop floor in order to have a more personal consultation generally in close proximity with the worker providing that service, and often in quite a small space. So, for example, within pharmacy, having your eyes checked by an optician, hair and beauty therapy treatments, and things along those lines. So that was the scope of our study, really, to look at people's use of face coverings and the factors that affect that behaviour in that quite specific retail context.
Okay, and is this specifically aimed at COVID? Because I guess it's relevant for all sorts of communicable diseases.
Yeah, absolutely. So I think the findings are definitely relevant and transferable. There's lessons to be learned and insight to be gained more widely than the COVID-19 virus. But the funding itself was emergent as a result of the pandemic. So the focus of the study was in the context of COVID-19, and obviously from a consumer perspective, the introduction of people needing to wear face coverings has only more recently, in recent years, as a result of the pandemic, come in. So that it was very much bound in terms of the focus of the study to look at transmission of COVID specifically, although our participants gave us insight in more widely in terms of other benefits or challenges.
Right. Okay. So, but presumably in these situations, you know, I don't know, you go to get your hair cut or something, you know, it never was mandatory for staff to wear masks or for customers to wear masks. But did any businesses kind of suggest ever before all this to their staff that, well, you know, you can wear a mask if you want, or, you know, or was it on the horizon at all?
Yeah, I mean, when you look at settings such as sort of community pharmacy and the more sort of health related, then obviously to an extent, depending on the service being provided, then there potentially was that behaviour already there to a certain extent, although not necessarily as consistent and frequent with regards to the variety of services that may well have been provided. But yeah, you're quite right. In terms of consumers and other settings such as hair and beauty, or having a bra fitting, for example, you know, I don't think people would necessarily have thought about needing to wear a face covering before the pandemic. And certainly it's fresh in people's minds now in terms of maybe how close they're going to be to somebody else, and equally, as I say, the size of that space that they're going to be in and the length of time, and therefore the potential for particles to transmit between individuals in that space. So I think we're all more mindful of sort of our breathing and proximity to others, and maybe how we might mitigate that and the risk that might present in different settings. And so obviously now...
Sorry, I interrupted, but have you found that businesses will now, not after COVID, because COVID is still going on, but whether now businesses give their staff any guidance or even any instructions, you know, that say, you know, you have to do this. This is company policy.
Yeah. So we have, and one of the interesting things about the study actually, or the interesting findings that came out of the study, was the differences between the different settings and professional groups. So we found generally on balance that members of the public had quite similar responses to those provided by hair and beauty therapists, whereas we found pharmacists tended to provide quite similar responses to other sort of health related retailers, so opticians, etc. And what we found was, particularly in hair and beauty, they continued to mandate the use of face coverings amongst their workers, but not their customer base. And the rationale for that in quite a few cases was to provide their customers with confidence that we're taking your health and well-being seriously, and almost a fear that they might lose business if the staff inside those premises weren't seen to be wearing face coverings. So they've, in a lot of cases, taken the decision to continue mandating the use of face coverings amongst their staff as an individual business, rather than necessarily needing that to be legislated from higher up from the government. Whereas certainly pharmacies, because they are a healthcare setting, technically they're under subtly different guidance and requirements to wider retail settings. So within a community pharmacy, it's still mandatory for both workers and members of the public in order to don a face covering when receiving services. So it is different, I think, in terms of the different retail premises that you visit, and certainly people are mindful of both the health requirements, but also the other benefits or barriers that come alongside that as part of running a business, and what impacts behaviour.
All right, well, following on from that, there's a question which it's probably a bit of an unfair question and impossible to answer, but I'll ask it anyway.
Have a go.
do you have any data or any thoughts on whether I don't know, nail bars that insist that their staff wear masks get more, do their customers prefer that? Do they get more custom because of that? Or conversely, does it put people off?
Yeah, and that's a really interesting question. Being absolute relative to the data, I would say no, we can't confidently say that, because the sample that we had was, I think, broadly 400 odd, something along those lines. So we can't make generalizations to everyone. And obviously, our sample also included a diverse representation of different premises. But certainly the feedback that we got from the retailers were that the customers preferred it, certainly in terms of health and in terms of hair and beauty settings, and that there was a feeling that was appreciated, and that they may well lose customers if not. But generally, I think people sort of tended to feel more comfortable. So the people that we spoke to in interview, in addition to the survey, were sort of describing to us increased feelings of confidence and generally reduced feelings of anxiety when those around them are wearing face coverings. But in terms of intention to visit those premises, if it's no longer mandated by either government or the retailer themselves, that was one of the questions that we asked on our survey. And generally, people said it wouldn't make a difference. There were a few exceptions to that rule, but generally people sort of said they would still continue to visit, but actually they might choose to adapt their own behaviour. So they might choose to visit a different location, potentially, if it was less crowded, for example, if there were no longer masks and face coverings being worn, or equally it might increase their personal likelihood that they would choose to don a face covering, even though other people around them weren't. So it didn't seem to, the findings that we did gather from the research seem to suggest that it won't necessarily impact people's willingness to visit, but it will impact their own personal behaviours in terms of when and how frequently and where.
Right. Okay. And another unfair, possibly impossible question. If customers are asked to wear a face mask, I mean, I don't know if this is even very common now, but say if you go to a nail bar and the shop says, please, to come in this establishment, would you mind wearing a mask? Any data on that sort of behaviour? Does that make people go away, or?
I don't know. I mean, we did a literature review at the very beginning of the research in order to inform the coverage of the survey and the interviews. And that was on international research that had already been conducted. And there were certainly findings in there in terms of some altercations that had occurred within retail premises where, whose responsibility is it to make sure that the customer or the individual is wearing one, and wearing one correctly is the other issue. So there's definitely some evidence in the literature at the time we did our review that suggests it can lead to conflict, it can lead to sort of a bit of an argument and verbal heated discussion, shall we say. So I think it's generally one of those things, and certainly just purely anecdotally from my perspective following the media, that seems to be something throughout the pandemic in terms of, well, who's going to enforce these rules? If something is a regulation, you've got to back it up with some teeth somewhere. So it's definitely a challenge, and certainly now the government has moved away from that and left it to our informed by now choice and personal risk assessment of what we do and how we behave in different settings.
Sure. Something that I probably should have asked you at the start is how you gathered this information. You mentioned that you had 400 data points, or you interviewed 400 establishments, or exactly how did you carry out the research?
No, that's okay. So the project started initially with an evidence review in terms of existing academic and grey literature to understand the work that had gone before and whether we could glean anything from that to take a step forward and really focus in on what we were exploring with our data collection. So that fed into the design of an online survey that people could access through Facebook. We reached out to various professional intermediaries, so professional bodies and groups, the federations and associations and things along those lines, to then push out and raise awareness of the study happening, as well as advertisement through the Protect National Core Study website as well. We also then used paid advertisement on Facebook to try and target the different groups that we were reaching out to as well. So we basically tried to make as much noise as possible at the beginning to get people aware of the study so that they could choose to participate if they wanted to. We then had our online survey ran for around about a month, I think, in terms of time. And simultaneously, we were interviewing people as well who either opted in from the survey to discuss their responses in a little bit more detail in terms of why they provided the answers that they had, or directly into interview. So people that conducted an interview without having completed the survey. And we did, I think there was 18 workers interviewed in total and 18 members of the public across the UK, so England, Northern Ireland, Scotland and Wales, and from different professional groups that fitted within the scope of obviously having delivered services within a retail consulting room, or members of the public who reported that they had visited those premises within a defined period of time before our research. So that was sort of the scope in terms of who was included and then how we gathered that data. So ultimately the findings that we've now produced our report and submitted back to HSE, and we'll soon be sharing infographics and video bites along with the final publication on our website and the National Core Study website as well. So if people want to find the inner details of what we found and how the work was conducted, feel free, go and have a nose because it will appear there soon. But yeah, effectively, that was the scope in terms of who we spoke to and where.
So it was pretty comprehensive,
I would say it's pretty comprehensive.
All right, just moving on. So that's the study works and stands up and is soon to be published. I mean, things have moved on a little bit since the lockdown and all that, but COVID is definitely still with us. Sometimes it's easy to forget that until you get it. Or someone gets it. In fact, we've all had it in my family. Most recently, just a few weeks ago. So it's still around. So, yeah. Again, a very difficult question. Kind of statistically, if you have a shop on the high street and someone comes in, or you have a member of staff there, what are the chances are currently that they've got COVID? Does anyone know? Again, a very difficult question. The chances of stopping someone at random on the high street and they've got COVID, is that high?
That is a very difficult question to answer, and I think there's so many complexities to the transmission of the virus that are easy to forget. I mean, you've got across the UK only, if we're looking at UK, you've got 4 devolved nations, all of whom have managed COVID differently with different regulations, requirements at different points of time. And you've also got different established practices beforehand, as we mentioned before, depending on where you work and your previous history. So there were a couple of our interview participants, for example, who mentioned that they lived in another country previously where the use of face coverings was commonplace. So there's all different factors, I think. And some of our participants also highlighted when we asked them about their vulnerability to the COVID-19 virus, and they sort of identified, well, actually, face coverings provide one of many mitigating measures that you can take. So there's obviously sanitizing your hands and surfaces. There's, trying to keep space where possible, which obviously in a consulting room is quite difficult when someone's up close looking at your eyes or trying to medically assess you in a pharmacy. But there's so many different factors that influence the likelihood and the risk of transmission, as well as whether someone's symptomatic or not, along with there's different rates. So colleagues across the Protect research umbrella are also looking at sort of transmission in hamsters, or, getting people to cough in broadly, the description would be cough boxes, but cough and see how far a distance those particles travel. And over what point since you've tested positive. So there's all different studies under the different Protect National Core Study umbrella that are looking at COVID transmission in different ways. So it makes the question that you ask very difficult to answer in different settings with different people of different ages.
Yeah, well, it's impossible, actually, isn't it, really?
Broadly.
Maybe the thing to do is take away some positives in the fact that most people's behaviour has changed, because I know, just personally, so this is anecdotally, I wash my hands more often now, and I got into that habit when we were washing them every time we went out, every time we came back, and really washing them properly as well with soap. Now I might not be be doing it quite as much as that as I was, but I'm still washing my hands more. And this is probably a positive thing, because I'm probably not alone. I imagine more people do that.
Yeah.
And I do find myself, if I'm chatting to people on the street, you know, whether they're a neighbour or what have you, I tend to leave a little bit more space between us. You can, you know, whether that's a good thing or not, because there's other issues involved socially. Maybe that's not so good, but you know.
But you make a really interesting point, because it is that shift in people's habits. And I think at the beginning of the pandemic, you know, it came so quickly, and it was alien to us, certainly in the UK, without having previously worn face coverings generally when in public. So it was all new, and it was a bit of a culture shock to the system. Whereas I think now, particularly over time, and our participants sort of shared this view as well, in that it's something that's now become, as you mentioned, it's sort of a new ingrained habit, the wearing of face coverings. People are used to putting them on when they leave their house, or when they get out their car, or when they enter the premises. So we didn't have very many people at all that said to us it's only when they enter the consulting space within that shop. It was already on and being worn for a length of time before they entered the retail consulting room. So people's habits generally, I think, have changed. And some of the benefits as well that workers in particular shared with us were that they were experiencing far less sort of other respiratory illnesses and seasonal flu, because the wearing of face coverings by their customers and staff seems to have made a massive difference. So that would suggest to me that they're doing something positive. And equally, I think, you know, even anecdotally, that's part of, you know, helping to motivate people in continuing that behaviour, because they're seeing that there's a difference actually when they've worked in the same job for years previously prior to the pandemic, and now through wearing face coverings for a few years, they're seeing a visible difference in their own health. You know, that it's things along those lines that are reinforcing those habits, and I think make it more likely that in some cases the behaviour will be endured over time, and people will continue to do it.
Yeah, because certainly before COVID, if you saw people, I don't know, say on the streets of London, and they might be tourists possibly wearing masks, you kind of look twice and think, you know, what's going on there? That's a bit different. But now it's just regular. So
I think
maybe that's a positive thing that's come out of all this. Although, and actually, some businesses where the staff wore masks, I'm thinking of nail bars, and they would wear masks because actually the smell of some of the
dust
is pretty.
With the nail dust as well, with the filing and things. Yeah.
Okay. All right. I've never actually been into one of these, but I've seen. I've walked past.
I'd love to say I do more often, but.
But it was always a surprise to me when I saw people working in these places and they did have masks on, and now it's just normal. So you know, this is a good thing.
But that's actually another thing that we found affects people's behaviour in terms of it being normal. So we had a few people that had mentioned that they had followed the news from other countries who were ahead of us in the pandemic, and therefore they'd started wearing face coverings before they were encouraged by our government. And they were sort of saying that actually in some cases they did feel sort of social exclusion or stigma, or you know, they received negative comment from other people that they didn't know as a result, whereas a lot of people sort of said generally it is more, as you mentioned, socially acceptable. And that does have a massive impact on people's behaviour and their willingness to continue doing something if it suddenly becomes abnormal. So I think it will be interesting over time to see where and how quickly that normality changes, and to what extent does it endure over time in particular settings.
Sure. So presumably the objective of your research, I guess, is twofold. It's to help people that have businesses or are starting businesses that involve, you know, this kind of thing, you know, whether it be cutting hair or nails or whatever it may be, and also potentially to inform the lawmakers of the land. So when the research is published, are both these things going to happen, do you think?
Well, hopefully. I mean, as I say, we are one of a number of studies that were funded by the Protect National Core Study in terms of sector-specific research in order to understand, you know, what's happening, what's the impact, how easy or difficult has it been for people to, you know, manage or try and mitigate against the viral transmission. So, another piece of work that I'm now involved in going forward is to draw together cross-sector work to understand the extent to which the findings that we've gathered so far are discrete or similar across those different sectors. So there's work being conducted, for example, in public transport. There's work being conducted within construction, within care homes, within food processing that I was a part of as well with colleagues at IOM. There is a piece of work now happening to try and draw all of that together and say, actually, to what extent are the risk factors for transmission the same or different? And to what extent can the recommendations, the policies and the practice be consistent, or where is there a need for there to be discrete guidance that's specifically mindful of the setting or the practices that are happening and the work that's being conducted? So there's other pieces of work, I would say, that are continuing onwards beyond this particular project that hopefully will help to sort of leave that legacy from the Protect National Core study that not only helps us now in terms of managing where we are as the government have moved towards that sort of living with COVID, if you like, approach to life, but also should new variants of the virus arise that become more problematic again, or should we find ourselves in a similar situation as we did, around about 2 years ago when this landed in the first place? Because there will be other pandemics or, situations that affect multiple countries and impact our behaviours. And so I think it's important that we really learn as much as we possibly can from the research that's happened so that we can put our best foot forward in a timely way in the future.
So with that in mind, if people want to access the work that you've done so far, is it all publicly available?
It is.
Apologies. How can they see it?
My computer's just told me it needs to reboot, so I'm trying desperately to find my mouse so that I can hit no. 1 sec, Mike. Sorry. Where's my mouse gone? Oh, do you know what? I'm going to go in this way. Sorry, I don't want it to cut you off midway through. There we go. Marvellous. Sorry, try again.
Okay, so with that in mind, if people are listening to this and would like to see the report on the research that's done so far, I'm assuming it's publicly available.
It is, or it will be. So the Protect National Core Studies, there's a page, if you literally Google Protect in capital letters NCS, there is a website that has been driven by the HSE with support from the Thomas Aston Institute in terms of making sure that the research that's delivered in the public interest is accessible to the public and workers and industry.
Right. And your report will be there?
It will be. It's not yet, because it was only submitted to the client at the end of last month. So it's currently under review, but we are hopeful that it will be listed very soon. But on the IOM website, we are this week planning to upload some high-level bites in terms of what's come out. So we've got infographics for the different worker groups, for the members of the public, and with regards to the policy, practice and research recommendations that have come out of our study that will be loaded up on the IOM's website. So if you search
what's the address of that?
Face coverings, if you search for face coverings and IOM World, then you should be able to find that there on our page.
Brilliant. All right, so this is very interesting. Thank you for chatting, Rebecca. I know this topic will go on and on because COVID is with us now, and it won't be going anywhere for a while, if ever. So I think this is important for all of us. So thank you very much indeed for chatting.
Thank you for having me.
Thank you very much to my guests on this week's show, and they were Dr. Andres Fonseca, CEO of Thrive, the mental health app, and Rebecca Cannon, Principal Scientist of Human Factors at IOM. And of course, thank you to you for listening.
That was the Relax Back UK show with me, Mike Dill. Thank you for listening, and please do join us again next time.